So hello everyone. In this video we are going to discuss about drug affecting the skin pigmentation. Before that we need to understand what are the different basic information related with skin pigmentation. What is skin pigmentation? What are the different factors associated with skin pigmentation? So skin pigmentation is a disorder of skin. Skin pigment is melanin synthesized by melanocytes. There are some cells called as melanocytes which synthesize this skin pigment, and the name of skin pigment is melanin. There is one amino acid involved in this process called as tyrosine. With the help of tyrosine kinase enzyme and series of chemical reactions, this melanin is synthesized by melanocytes. Interesting point here, higher the quantity of melanin, darker is the skin, and less melanin causes certain diseases like hypopigmentation. Example of such hypopigmentation disease is vitiligo, while high melanin causes hyperpigmentation. Means two important terms are here. One is hypopigmentation while second one is hyperpigmentation. Hypopigmentation means less melanin, lesser than normal quantity, and if the quantity is high then it causes hyperpigmentation. Next point, if the person is facing problems like skin pigmentation, what will be the aim of treatment or what we can expect from the treatment? The first point is to reduce localized hyperpigmentation, to enhance pigmentation in acquired localized skin disorders with hypopigmentation like vitiligo, and to treat diseases like acanthosis nigricans. Means this whole treatment is associated with quantity of melanin. If its quantity is low, we need to increase it. If its quantity is high, we need to reduce it. And there is one important disease associated with this skin pigmentation which we will discuss later, that is acanthosis nigricans. Agents which can be used for treatment of skin pigmentation. So there are different agents like hydroquinone, monobenzone, then methoxyline. So these are some agents which can be used for treatment of skin pigmentation. There are also psorialine compounds available, but we have to use them along with the exposure to the UV light so that they can stimulate melanin synthesis and which results in repigmentation. So there are three important agents like hydroquinone, monobenzone, methoxyline, and also psorialine compounds. Psorialine compounds used with exposure to UV lights so that they can stimulate melanin synthesis and it leads to repigmentation. Hydroquinone. So it is topical skin whitening agent which decreases hyperpigmentation associated with freckles and melasma. It inhibits tyrosine kinase enzyme required for melanin synthesis, and it can be used as 4% concentration. Monobenzone is a benzyl ether of hydroquinone, sometimes can be used in skin discoloration occur due to conditions like vitiligo. Next is methoxyline. So it is photoactive substance. It stimulates melanocytes, used for repigmentation agent for the patients having the problems like vitiligo. PUVA, that is psorialine plus UVA radiations. As I told you earlier, if you have to use psorialine, then it should be combined with UV radiations, and this treatment is called as a PUVA, that is psorialine plus UVA radiation. Methoxyline inhibits cell proliferation and promotes cell differentiation of epithelial cell. So what is the mode of action of methoxyline? It inhibits cell proliferation and promotes cell differentiation of epithelial cells. Now we will discuss about disease associated with skin pigmentation, that is acanthosis nigricans. This is condition with the dark hyperpigment velvety thickening in body folds. In body folds we can see that there is a dark hyperpigmented and velvety thickening patches are present. This condition is common with the people which are obese or having diabetes or insulin resistance like condition. So this is a problem particularly seen in the patients which are obese, means they are overweight or having a problems like diabetes. Inside their body there is a resistance to insulin. So this condition is common with these people. Hyperkeratosis occur due to tyrosine kinase receptor, insulin growth factor receptors. So this overall situation associated with certain receptors or certain biological agents like tyrosine kinase receptor, insulin growth factor receptor, fibroblast growth factor receptor, epidermal growth factor receptors, and etc. So what is the treatment recommended? So treatment is, it is symptom related treatment, means if the person is obese then weight loss should be there. If the person having diabetes, then medications for insulin resistance like metformin or topical retinoid should be prescribed for such patients.